It's a pleasure to share with you my humble experiences with Secret Duo platform, which is, in my opinion, the state-of-the-art platform. And I would like to say you something more about this device. As you probably know, the Secret Duo is the ultimate multi-platform system for non-ablative skin remodeling. So, Secret Duo is a comprehensive medical platform for non-ablative skin remodeling in combined therapies and individual procedures. Secret Duo is the first device encompassing RF, radiofrequency microneedling, and 1514 nanometers erbium glass non-ablative resurfacing laser for skin resurfacing. We can use these two technologies in combination or individually for completely tailored treatments depending on patient skin type and concern. And Secret Duo is also a new version of a global bestseller, Secret RF device, with all the advantages of the brand, including the Smart Cure head for endolifting and RF microneedle, as well as a full range of specialist cannulas, needles, and treatment tips. Of course, safety is first. The effectiveness and safety of the device operation are guaranteed by the CI and FDA medical certificates. Secret Duo offers the dual non-ablative fractional technologies of a microneedle RF and 1514 nanometers erbium glass laser device as a total solution for aesthetic treatment. These two technologies can work individually or in combination to provide optimal treatment flexibility to all patients. This is the new combined non-ablative fractional resurfacing technique, offers a much gentle process with significantly reduced downtime and recovery time. So for face treatments, you can use Secret Duo for non-ablative skin resurfacing, tone and texture improvement, active acne and acne scars, wrinkle reductions, non-surgical facelifts, atrophic scars, skin lifting and tightening, and of course, pore reduction. For body treatment, we can use this device for skin tightening, scars, spider veins, and stretch marks. When we look at the 1514 nanometers fractional laser, we can use it for non-ablative skin resurfacing, for active acne, atrophic scars, wrinkle reduction, skin lifting and tightening, and tone and texture improvement. Fractional microneedling is very good for non-surgical facelifting, for skin tightening, wrinkle reduction, pore reductions, acne scars, spider veins, and stretch marks. Secret Duo provides a novel treatment combination that delivers more effective clinical results with virtually no downtime and minimal side effects. With Secret Duo, patient will experience continual improvements in the 6-month follow-up treatment session, leading to higher satisfaction and disruption to everyday functioning. Patient will experience improved smoothness, elasticity, firmness, and texture for about month of treatment, ultimately giving them healthier, younger, and fresher looking skin. Secret Duo also facilitates effective treatment of a wide array of skin disorders and complications. This increases your potential income and delivers a high of ROI. So when we come a little closer to microneedle RF mode, we can show that there is an accurate penetration depth control up to 3.5 millimeters. There is a minimally invasive process and greater and deeper volumetric heating. And what about 1514 nanometers fractional laser mode? It has low water absorption with deep penetration, no vaporization, gentle treatment process, wider and greater volumetric heating. So, Secret Duo uses precision 2 MHz bipolar RF and minimally invasive microneedles in a single device to produce a powerful synergistic effect that minimizes damage to the epidermis. Precisely controlled RF energy induces a subdermal thermal effect and deep dermal thermal coagulation to selectively adjusted depths from 0.5 to 3.5 millimeters via patented non-insulated microneedles. Secret Duo is capable of powerful heating and denaturation, which stimulates fibroblasts in both the subdermal and dermal layers for effective skin remodeling. Secret RF can treat all skin types, including dark skin, with a low risk of side effects or PIH. On this slide, you can see the histological photos. In a figure 1 is a deep dermis denaturation, and in a figure 2, you can see the collagen regeneration and wound healing process after 2 weeks of treatment with radiofrequency microneedling. How Secret Duo works. First step, the microneedle cartridge makes perfect contact with the skin. Next, microneedles smoothly penetrate the skin. The third step is bipolar RF energy denaturalize the tissue. And finally, we've got the process of regeneration, collagen regeneration, and new elastic production begins. So what about 1540 nanometers fractional laser? There is a quick and easy operation. Scanning technology makes it possible to provide rapid treatment across a range of treatment areas with an easily adjustable scan size from 1 millimeters to 10 millimeters. Fully customizable patterns also enable more treatment options depending on the shape of the indication. We've got 5 different scan patterns: cycle, half cycle left, half cycle right, square, and triangle. For more treatment options, scan size is from 1 to 10 millimeters. Dot size is 0.1 to 2 millimeters. And of course, we've got eye motion technology, which gives less downtime and more effective treatment. This is multi-sub pulses, which allows deeper penetration with less heat dissipation and thermal damage to surrounding tissue, which promotes a better healing process without unnecessary damage to the epidermal layer. In Secret Duo, in 1514 nanometers erbium glass laser, we've got 2 kinds of lenses. The standard lenses, it's 300 micrometers lens, and optional is 600 micrometer lens. The optional lens enables a much gentle resurfacing process with virtually no side effect and quick recovery time. So, what are the technical highlights? Secret Duo has several exclusive technical features that ensure even coverage of the target areas and maximize treatment safety for both practitioners and patients. We've got reliable and effective results. Secret Duo has the outstanding ability to deliver the most precise thermal effect to the correct skin depth with minimal downtime. Furthermore, the Secret Duo's non-insulate fine needles create greater sub and deep dermal remodeling while stimulating both layers at the same time. You've got minimal discomfort and uniform thermolysis. There are the finest medical grade needles demonstrate the highest level of smooth surface quality and durability, enabling uniform energy delivery and even coverage of target areas while avoiding any unwanted damage to the surrounding tissue or uneven coagulation. There is a very precise and safe treatment. The delay time and visual indicators are patient safety functions that hold the needles in the final position until the RF emission is completely finished. This exclusive motion control technology offers maximum safety by preventing any unpredictable damage to skin surface during an operation. Those are the lenses, as I said before, and we've got 2 precisely functioning handpieces, and the best handpiece is the high-speed handpiece for expert, offers a faster needle motion technique that enables more rapid and precise treatment in tandem with both standard and 64-pin cartridges. And what about cartridges? Of course, we use several variety of cartridges, but I mostly use 25-pin non-insulated microneedle cartridge for face and neck treatment. But of course, there is a 25-pin semi-insulated microneedle cartridge is required for greater thermal effect on subcutaneous tissue. And you've got 10-pin non-insulated microneedle cartridge, which is very gentle and it's very good for stretch marks, nasolabial folds, and crow's feet. And of course, there is for body, there is the best 64-pin semi-insulated microneedle cartridge, which gives very good results in dermis and subcutaneous tissue for body treatment. The finest medical grade needles demonstrate the highest level of smooth surface quality and durability, enabling uniform energy delivery and even coverage of target areas while avoiding any unwanted damage to surrounding tissue or uneven coagulation. So, Secret Duo has very advanced and in other side, very simple GUI, which is very quick and easy to use. The user-friendly GUI offers effective preset parameters for a variety of conditions, making it simple and easy to use for any practitioner. Of course, when you work in RF mode, you can choose auto mode or manual mode. Auto mode is very simple and you can do everything automatically. When you want to be when you are more experienced and when you want to change any parameters, you can switch to manual mode and you can choose the parameter like intensity, like RF duration in milliseconds, depth, mode, and delay time. Of course, there are presets which you can adjust to your as you prefer. When you work with 15-14 nanometers erbium non-ablative erbium glass laser, you can change energy power, you can change distance between dots, eye stack, and mode. Of course, you can change the shape type and type of the scanning of your lens. And there is a very interesting thing, which is Smart Cure. The Smart Cure is a smart electropen which enables a range of thermocoagulation techniques in combination with a single electrolysis needle and a variety of knocker needles to treat, and of course cannulas to treat a larger range of applications from spider veins to acne, wrinkles, and depressed scars, and of course for endolifting. And we've got a lot of tips and needles. For example, we've got the K3i insulated single electrolysis needle, which can be used for treating undesirable thread and spider veins by delivering heat solely to the target vein without risk of damage to the epidermis and surrounding tissue. It is very thin, and the results to close the vessel, for example, near the nose, are excellent. The next is the AC01 insulated single needles, which smoothly penetrates the skin and generates heat stimulation in the fibroblast in order to improve wrinkles and skin texture via collagen regeneration and skin remodeling. And of course, combined with RF energy, the subcision technique provides significant long-term improvement in scars by inserting a needle under the skin parallel to the skin surface and moving gently back and forth between the dermis and subcutaneous tissue. Now I would like to share with you my humble experiences with lower face and neck RF endolifting in combination with RF microneedling and erbium glass non-ablative laser. In my own practice, I have performed about 60 procedures with combination of this technique using the Secret Duo platform, and my results are quite good, and there is no severe complication occurred. So what is known now about these three kinds of techniques? First, till now, there are a little evidence supports improved efficacy or easier recovery after subcutaneous RF treatments, compared with results that may be obtained using traditional methods such as submental lipectomy or liposuction. Controlled studies are lacking, the treatments are not innocuous, complications are common. Investigator conflict of interest taints published study. We know it from Annals of Plastic Surgery from last year. What about radiofrequency microneedling? there is an effective and safe method of improving skin tone. Energy delivery is efficient into the dermis with minimal disruption of the epidermis, particularly for insulated needle devices. Radiofrequency microneedling should be considered the new standard for treating acne scarring, particularly in darker skin types, as well as the minimal invasive neck rejuvenation laxity solution. And of course, the high fluence 1540 nanometers fractional erbium glass laser is very safe and very effective non-ablative modality for facial rejuvenation. And what about my experiences with these three types of procedures? This presentation summarized my observations of patients who underwent subcutaneous thermolysis and endolifting RF treatments using RF cannulas in combination with radiofrequency microneedling and erbium glass fractional laser. Treatments included lipolysis and thermal endolifting using radio waves emitted by a blunt 19 gauge cannula. Treatment areas were the jawline, side surfaces of the neck, and chin. The indication for the procedure were significant flaccidity and drooping of the skin in the area of the chin, jawline, and neck, as well as an excessive amount of subcutaneous fat in the above areas. In all cases, RF endolifting treatments were combined with radiofrequency microneedle and erbium glass laser. In case of excessive amount of subcutaneous adipose tissue, the procedure of syringe liposuction was additionally applied. So, preparation for the procedure. Before the procedure, a thorough medical interview was conducted with the patient about chronic diseases, allergies, medications, previous aesthetic medicine treatments. And of course, physical examination and assessment of the treated skin were performed. All potential side effects, as well as a possible complication and expected effects of the procedure were presented. The patient's informed consent for the procedure was obtained. Photographic documentation was made before the procedure. The procedure were performed in the conditions of a treatment room. Skin disinfection and single sterile drape of the treatment area were used. The treatment areas were marked with a sterile marker. And what about the treatment technique? Of course, I used the infiltration anesthesia of the cannula insertion site, which was performed. There were 2 points on both sides in the pre-auricular area at the level of the middle part of the mandibular branch, and 1 point under the chin at the top of the mental triangle. It was 30 gauge needle with 2% lignocaine and 100% 0.2 milliliters adrenaline. It was about 2 to 3 milliliters per point. And next, an 18 gauge needle was punctured at designed points for cannula access. Then I used 22 gauge 70 millimeters cannula and insert it subcutaneously on both sides from the preauricular and submental approach, and administering the fan technique of anesthesia in the amount of 15 to 20 milliliters per area. A solution was used for anesthesia. It was 100 milliliters of saline, 5 milliliters of natrium bicarbonicum, 5 milliliters of 2% lignocaine, and 0.2 milliliters, 100% adrenaline. The anesthesia cannula and its fanning motion were additionally used as a paving tool for the RF cannula. In the next stage, a blunt RF 19 gauge 70 millimeters cannula was inserted through the prepared holes. Then subcutaneous thermolysis was performed using the RF 19 gauge 70 millimeters cannula bilaterally in the region of the jawline and the lateral surface of the neck and chin. The procedure consisted in inserting and withdrawing the cannula along the places marked with a marker to obtain a temperature reading from the skin surface of 42 Celsius degrees with a thermal imaging camera, and lasted about 1 minute after this reading. During the procedure, excessive overheating and deep penetration of the cannula in the jawline were avoided in order to protect the superficially located mental branches of the facial nerve. During the procedure, excessive retraction of RF cannula tip was avoided so as not to burn the skin at the cannula insertion site. Okay, of course, I remembered about face anatomy, and I know that in this region, especially in a jawline region, there are a mental, rather superficially located mental branches of the facial nerve, and to remember it, we should perform this procedure at this region very gently and assess the patient. But in my patient, which are in my procedures which I perform, there was no complication connected with facial nerve, any problem with facial nerve. Of course, we should remember about the fifth nerve, and mainly on this region about about the aperture of the mental nerve, which is located rather deep in the under the region on which we will perform the procedure. And of course, I remembered about our arteries on our face, on your face, especially facial artery, which cross the region which I was working on. Treatment technique next. The duration of the procedure was determined by the temperature read from the surface of the skin. On average, the entire procedure lasted about 30 minutes, which in terms of body surface area gave 2 to 3 minutes per 3 to 4 square centimeters. Syringe liposuction. I used 12 gauge 15 centimeters microcannula, Dr. Moses, and 10 or 20 milliliters aspiration syringe named Vacloc. Procedure was performed in all cases due to a significant amount of residual fluid after thermolipolysis, and in some cases due to excessive amount of subcutaneous fat in the chin area. During the procedure, the patient's well-being and condition, of course, were monitored. Post-treatment care, all patients were advised to use an elastic band for 48 hours after surgery, and then every night for 7 days. The patient was advised to contact the physician immediately if signs of inflammation and other complication appeared. In the case of proper healing, the follow-up visit was set in 30 days. All patients underwent combined microneedling, RF and erbium glass laser therapy. There was 3 treatments planned at 3 weeks intervals. And let's move to my patient. Patient number 1, this is a woman in her late 50s. She expects the face oval to improve. She complains of flaccid drooping skin around the jawline and chin. Previously, she had numerous treatments for reducing wrinkles in the upper half of the face with botulinum toxin, volumetry of the middle part of the face with hyaluronic acid, and skin lifting in the area of the jawline and chin with the use of PLLA threads, Aptos, thread method, threads, or needle methods. Healthy so far, no chronic diseases, no allergies in the medical history. In the examination, the facial skin was quite thick, flaccid, capillary. The wrinkles of the forehead and the eye were quite good, this area where it was smooth. The cheeks and the yolk area are slightly sunken, increased flaccidity and ptosis of the skin in the jawline, neck, and chin. So RF thermolifting treatment with the use of a cannula was proposed and followed by a series of 3 combined secret duo, secret RF and erbium glass treatments. Sorry. And this is this patient's. So the description of the procedure. So there was a thermolifting treatment performed with energy 25 watts in continuous wave mode, areas both sides of the jawline and side surfaces of the neck and chin area using a blunt 19 gauge 70 millimeters cannula. Immediately after the procedure, 20 milliliters of fluid fat content was aspirated from the chin area using 20 gauge 15 centimeters micro cannula and aspiration syringe. An elastic band was applied, and after 3 weeks, a series of 3 secret RF and erbium glass procedure were performed. This is this patient, and you can see on the photo on the left that the patient has a problem mainly with her jawline region, cheek, and neck. There was a very flaccid skin in a jawline area. And in the photo on the right, you can see her 90 days after the all combined procedures, so endothermolipolysis and subcutaneous, and of course, 3 sessions of combined procedures with secret duo. So as you can see, the results are quite good, and the patient was very happy with the result. This is her different view, and there is a significant improvement, mainly the jawline area, but to the chin and neck area. And in her side view, the improvement is visible too. So, summary, the procedure was performed without complication. The patient followed the post-operative recommendation. Healing proceeded normally, apart from the fluid reservoir, which was evacuated on the 7th day after the procedure. The patient assessed the procedure as painless and the final effect of the procedure as satisfactory. Radiofrequency treatments, microneedling, and erbium glass laser at intervals improved the skin tone of the face and neck. What are the conclusions? Thermolipolysis and endolifting with the use of RF cannula in the lower part of the face and chin in the patient brought a spectacular visible effect, which was visible in the control photos. Radiofrequency treatments, microneedling at intervals improved the skin tone of the face and neck. 1 week after, there was a complication because some fluid was occurred in the region of chin, but there was no signs of inflammation. I control it via ultrasound, and I suck out about 8 milliliters of serous fat content, and after that there was no complication. No other side effects or complication of therapy were observed throughout the post-operative period. The second patient is a female in her late 50s. She expects the face oval to improve. She complains of flaccid drooping skin around the jawline and chin. At the same time, she wants to smooth and improve the texture and tone of the skin. Previously, she had numerous treatments for reducing wrinkles in the upper half of the face with the use of botulinum toxin, hyaluronic acid, and mesotherapy. Healthy so far, no chronic diseases, and no allergies in medical history. In the examination, the skin was moderate thickness with numerous wrinkles and furrows. There were 2 to 3 degree wrinkles on the forehead and around the eyes, valley of tears and sunken cheeks, increased flaccidity and ptosis of the skin in the jawline, neck, and chin. An RF thermolifting treatment with the use of cannula was proposed, followed by a series of 3 RF microneedle, radiofrequency, and erbium glass laser treatments. I performed treatment using 19 gauge 70 millimeters cannula. It was RF thermolifting with energy 25 watts in continuous wave mode. The areas were both sides of the jawline and side surfaces of neck and chin. Immediately after, I aspirated about 4 milliliters of liquid content, and using 20 gauge 15 centimeters microcannula, a pressure dressing was applied, and after that there was after 3 weeks there were 3 series of 3 secret RF and microneedle and erbium glass procedures performed. On this slide you can see this patient before and after treatment. She had numerous wrinkles, she had numerous furrows, and saggy and flaccid, very flaccid jawline area and chin and neck area. In the middle photo, you can see her 30 days after endolifting and after first microneedling combined with erbium glass laser. And in the photo on the right, you can see her 90 days after endolifting and after third combined procedure microneedling and erbium glass laser. So you can see the quite good result of the jawline elevation, better smoothness of the face and neck. This is her next view of this patient with the jawline elevation, with the chin elevation and improving of the skin in the neck area. And the side view of this patient before and after. And the patient was quite happy with the results. There was no complication. The procedure was performed without no complication. The patient followed the post-operative recommendation. Healing was going well. The patient assessed the procedure as painless and the final effect of the procedure as very satisfactory. And the conclusion was the same. Performing thermolipolysis and endolifting brought very good, great, spectacular effect of the jawline area, of the skin of the face, and then radiofrequency treatment combined with microneedling and erbium glass laser at intervals improved the tension of the skin of the face and neck. And throughout the post-operative period, there was no side effects, no complication of therapy, and patient was very happy. Next patient is the woman in her late 50s. She expect an improvement of the oval of the face and reduction in the amount of subcutaneous fat. He complains of flaccid drooping skin in the region of the jawline and significant fatness in the region of the chin. Previously, she had not undergone plastic surgery and any aesthetic medicine procedures. There was obese patient, so apart from obesity, no chronic diseases, no history of allergies. On examination, the facial skin was thick with an abundant amount of subcutaneous fat, increased flaccidity and ptosis of the skin in the line of the jaw and chin, a significant amount of subcutaneous fat in the chin area. RF thermolifting treatment with the use of a cannula was proposed, and of course, due to the obesity, I suggested and introduced her subdermally a GLP-1 receptor analog for obesity treatment. After 3 weeks, a series of RF and microneedle therapy was started. And I used about 30 watts in continuous wave for thermolifting, of course, using 19-gauge 70 millimeters cannula connected to Smart Cure. Immediately after the procedure, I sucked out about 25 milliliters of liquid content with 12-gauge cannula. Next, the elastic band was applied and patient started to take a GLP-1 receptor analog for obesity. After 3 weeks, next series of three combined microneedle and erbium glass laser procedure was performed on her face. This is this patient. In the photo on the left, you can see her before the treatment. In the photo on the right, you can see her 90 days after. I use combined technique with aesthetic medicine and pharmacotherapy because of a global holistic problem with this patient. But you can see the quite good result of the jawline region, a little improvement of the chin and improvement of the neck, which the patient saw the same results as I saw. You can see the elevation of the jawline, a little enhancement of the jawline region and neck and chin after 90 days therapy. And this is her side view with a significant improvement, not totally, but significant improvement. Summary: the procedure was performed without complication. The patient followed the post-operative recommendation, healing was going well, and the patient assessed the procedure as painless in the final effect of procedure as a very satisfactory. Of course, the same conclusion, thermolipolysis at that patient brought very clear improvement visible on the control photos. Of course, combination of microneedling and erbium glass lasers affected to appearance of the face, and there was no complication. And of course, we should remember that when the patient has obesity, there is his global problem, and we shouldn't focus only on his face, but we should start to treat the patient with pharmacotherapy. The next patient is a 38 female. She expects the face oval to improve. She complains of flaky, drooping skin in the area of the jawline, chin, and strongly marked nasolabial folds and marionette lines. Previously, she had numerous procedures: hyaluronic acid, botulinum toxin, thread implantation. So far healthy, no chronic diseases, no allergies. In the examination, the facial skin was thick with numerous pores, forehead and eye area wrinkles 2 to 3 degrees, sunken cheeks, increased flaccidity and ptosis of the skin in the jawline, neck, and chin. And of course, thermolifting, RF combined with series of 3 RF microneedle, radiofrequency, and non-ablative erbium glass laser was proposed. I performed the procedure using 30 watts in continuous wave mode with a blunt 19 gauge cannula. After the procedure, I aspirated about 15 milliliters of fluid content, and elastic band was applied. And after 3 weeks, a series of 3 combined radiofrequency and erbium glass laser procedure were performed. So this is this patient. In the photo on the left, you can see her before the treatment. In the middle photo, you can see her immediately after treatment. So there is no big swelling. There is no big enlargement of the face after this procedure. And in the photo on the right, you can see her 40 days after. So it was after the endolifting and after the first session of combined procedure with microneedling, radiofrequency, and erbium glass laser. This is the same patient from a different view. You can see the spectacular improvement of the jawline and chin and neck area. Patient was very happy with the results. It was the first procedure in her life which gave a very good improvement of her face, as she said me. So this is her side view. You can see improvement of the jawline area, improvement of the chin, and improvement of the neck after these procedures using Secret Duo. Summary: the procedure was performed without complication. The patient followed the post-operative recommendation. Healing was going well, and the patient was very satisfied. And conclusion are the same like before. But we should remember that when there is a thick skin and abundant subcutaneous fat, we should use a little more energy, RF energy, during thermolipolysis. It was about 30 to 35 watts in continuous wave mode. And the next patient is very interesting because it's the runner. Is the woman in her early 50s. She is a runner who intensively practiced endurance sport. In her youth, she suffered from a severe form of juvenile acne, leaving numerous furrows and scars. She expects the reduction of wrinkles and depressions resulting from adhesions with acne scars. She had not had any surgeries before. Healthy so far, no chronic diseases, and no allergies in the medical history. In the examination, the facial skin was thick and porous. On the cheeks, around the chin, and around the mouth, there are numerous atrophic scars quite strongly fused with the subcutaneous tissue dragging the skin. And An RF thermolifting procedure was proposed with the use of a blunt 19-gauge cannula and scar cutting with a cutting needle, followed by a series of 3 RF microneedle radiofrequency treatments combined with erbium glass fractional non-ablative laser. So, RF thermolifting treatment was performed in energy with about 30 watts in continuous wave mode. Areas bilateral jawline and side surfaces of the neck and chin area using a blunt 19-gauge 70 millimeters cannula. And I performed undercutting of acne scars in the area of the cheeks and jawline, which was performed using the RF undercutting needle named Nocor and blunt cannula with energy 25 watts in continuous wave mode 2. Immediately after procedure, I sucked out about 10 milliliters fluid content, an elastic band was applied. After 3 weeks, we started to perform a series of combined procedure of microneedling with a non-ablative erbium glass laser. And you can see this patient. In the photo on the left, of course, this is the woman before the treatment. And in the photo on the right, you can see her 30 days after endolifting, after subcision of scars, subdermal subcision of the scars, and right after the first combined RF and erbium glass laser. In my opinion, there is a very good, very suggestive improvement of the face, reduction of furrows, reduction of scars, of holes in her face. Now you can see her from a different view with improvement of the face region near the lips, a little improvement of the jawline, but it wasn't her main problem. And this is the same patient in other different view, and the result, in my opinion, were quite good. So, summary: the procedure was performed without complication. The patient followed the post-operative recommendation. Healing was going well. The patient assessed the procedure as a painless and effect of procedure as very satisfactory. Conclusions are the same like before, but from the point of view of qualification for procedure and indication, the therapy with the use of RF cannulas and cutting needles turned out to be safe and highly effective in this patient. So the last patient is the patient number 6. This is the young 40-year-old woman. She expects the face oval to improve. She complains of flaccid, heavy, drooping skin in the area of the jawline. She would like to improve the facial triangle. Previously, she had numerous treatments, all kind of treatments she had. She has lifting with threads, facelifting with threads. She has a lot of hyaluronic acid. She has Botox, mesotherapy, and other procedure. Healthy so far, no chronic diseases, no allergies in the history. In examination, the skin of the face was thick with numerous pores, intensified flaccidity and ptosis of the skin in the jawline and neck and chin. And RF thermolifting treatment with the use of a cannula was proposed, followed by a series 3 microneedling, RF, and non-ablative erbium glass laser. I use 35 watts in continuous wave mode, using blunt 19-gauge 70 millimeters cannula. I sucked out with a backlog about 4 milliliters of liquid content. An elastic band was used, and after 3 weeks, she started to series of 3 combined microneedle radiofrequency treatments with erbium glass laser. And this is this patient in the photo on the left before the treatment, in the photo on in the middle photo immediately after endolifting, and in the photo on the right 90 days after all procedures. The same patient from different view. Appearance of her face was improved, and she was very happy with the results. Finally, I gave her a hyaluronic acid in a chin area, and she was finally very happy with the results of endolifting and combined procedure with Secret Duo. Summary: the procedure was performed without no complication. The patient followed post-operative recommendation. Healing was going well. And the patient assessed the result as quite good. So conclusions were the same as previous. And finally, what are the general conclusion? In my experiences, lower face and neck RF endolifting in combination with RF microneedling and erbium glass non-ablative laser brought measurable results. Due to the progressive aging of the European population, it can be assumed that about a quarter of the population is currently in age between 40 to 65 years. This is a significant group of patients who potentially have significant problems with skin laxity in the area of the lower part of the face, chin, and neck. Most patients will seek less invasive methods with a short recovery period and will accept less spectacular results compared to surgery. Since the beginning of the 21st century, we have been observing a powerful development of minimally invasive methods to improve skin tension in the lower part of the face and neck. The results of use of transdermal RF treatments published so far in shrinking skin of the lower part of the face, neck, and chin are shown as a very high effective. But recently published systematic review of this subject is very controversial and uncertain. So in my opinion, further independent research and expert opinions on this matter are needed. Summarize. The Secret Duo device, it's a very intelligent and state-of-the-art platform, which I love to work with. It's the first device which combined a fraction microneedle with an erbium glass laser, and it is very good for working with a patient. There is a range of treatment options for the epidermis and dermis. This is a totally multi-platform. Multi-platform functionality enables bipolar and single needle. What about laser? Of course, we know that the erbium glass laser could seem very gentle, but it brings very good and very spectacular results on our patient faces. We've got a range of needle tips. And of course, eye motion features from this laser is very, very interesting and gives very good results. So this is all till time. Okay, we are on the theater. We are prepared to the procedure. We are together with our patient. This is a woman in her late 40s, and she would like to improve the jawline region here, and he would like to improve the chin and neck region. This patient had never before any aesthetic medicine procedures, so this is her first contact with aesthetic doctors. She is in her medical history, she has hypertension, but good control with the medicines, and there is no other medical problems, no allergies. I spoke with the patient, I talked with the patient before, and I talked about this procedure, about the result of the procedure, about any problems which could appear after. And patient know everything about it. We will start the procedure. So finally, as you can see, I will work on a jawline region. I will work on a neck and submental area. And now I will show you what is on the operating table. This is our table, and as you can see, we have all what is necessary for the procedure. First, we have anesthesia with lignocaine and adrenaline. we've got 19 gauge needle, we've got cannula for infiltration, we've got cannula for liposuction and syringe for liposuction, and every other I will show you during the procedure. So now I will mark the region with I will working with. Okay, one moment. Now I will show you the point of entrance, and in the preauricular region there is a place when we can be quite safe, but we should remember that in this region there is a saline gland. Deep in the deep area there is a facial nerve, but when we will work in the second layer, we will be and our patient will be very safe. Of course, in the region in front of masseter, is it here, there is a facial artery, but this facial artery is coming deeply in the deep surfaces when our cannula will not work in. But we should remember that facial nerve gives the branches very superficial in that area. So we should work very safe. We should be very aware of this region, because this region is with the branches, with the facial branches and the branches of the mental here region. So the point of our working will be in that place. I will be using fanning technique on this, in this position, and next I will go down to the neck, and I know that my cannula is 70 millimeters long, so I have to manage that it will be such like this. Next, I teraz proszę główkę do góry. Next, the next point of my work is the submental region, and dobrze widać chyba. And I will use a fanning technique to go from all over this area in submental region. And of course, the next side, this is the second, this is the third place of my entrance. And this is the places of approach. So you can see that using special cannulas, using special techniques, I can achieve all the regions in the jawline area, in the chin, and in the neck. So I want to use about 25 to 30 watts in continuous wave mode in radio in RF secret duo to perform to disturb the subcutaneous fat and perform overheating in these places. So now we please our patient to lie down, and I start to perform the procedure. Now you can see the secret duo interface, and as you can see, this is on the left RF mode. In the middle, there is a 15-40 nanometers erbium glass laser. On the right, there is a smart cure, and we will work with a smart cure adjustment. Now we turn the smart cure on. Okay, and you can see we've got several presets. We will work with this is subcision, and we will work with continuous wave mode. Please turn continuous wave, CB, wyżej. Tak. And we will start from 25 watts power. As you can see, we've got 25 watts in continuous wave mode. And this is the adjustment for this procedure, and we will start from that point. As you can see, there is a surgical cover for the head, for the chest. We try to be very sensitive. All operating process is very strictly. Now I have syringe with anesthesia. It will be only at the point of entrance. This is lignocaine 2% and and 1 drop of adrenaline. Okay. The needle is 30 gauge. It's a 20 millimeters 30 gauge needle. And you can see, teraz macie zbliż troszeczkę. This is the first entry point. Okay. Now I give a small amount of anesthesia in the point of entrance. Trochę boli, czy nie? Troszeczkę. To jest najmniej przyjemne tak naprawdę z tego wszystkiego. Okay. Now in the submental area here. And left side. And left side the same. It's about 2 milliliters for entrance. Okay. Now we prepare the smart cure electropen, because as you know, the smart cure is on a cable and we should avoid any contact with the patient. So we've got special plastic bag for the cable. Okay. Over. Look at this. This is smart cure. I will catch the smart cure during the plastic bag. Now we Now I've got a smart cure without cannula. Now the Kasia give me the cannula. This is the smart cure RF cannula. This is a 19 gauge 70 millimeters cannula. On the top of the cannula, on the top of cannula, there is a heating point of radio frequency. So now I put in the next stage, I will use the fanning technique cannula. Now I use the 18 gauge needle. Teraz główeczka leciutko na lewą stronę. To entrance for cannula. In the submental region 2. And on the left from the other side. Okay. Now I have anesthesia, tumescent anesthesia. This is a saline, natrium bicarbonicum, adrenaline, and lignocaine. Now I'm going subcutaneous. Now I'm going subcutaneous and using fanning technique. Będzie pani czuła takie dziwne uczucie. This is a 20 millimeters of solution. Patient feels something strange, but there is no pain. Now I'm going down to the neck. There was 20 milliliters of solution. I will give a little more. Okay.
Sam postęp nie potrafił, jak się wchodzi.
Jak nie będzie.
Tak też na przykład twoje ręce teraz łapię.
Okay. This is a little edema in that place after. And now the next fanning technique in the submental region. Jak się pani czuje? Jak pani widzi?
Dobrze.
Okay. As you can see, is the fanning technique.
Teraz dobrze. Nikt nie zasłania. Jest podkreślone.
It was 10 milliliters for the left side. There is a little edema, little swelling. This is a 22 gauge cannula. It prepared the field for working of RF cannula. Okay. Proszę się zwrócić na drugą stronę. And now I will use the same solution for the left side. This solution is very good for heat transmission, of course. There is a better heating when there is a water under the skin. I am in the superficial layer. Jeszcze trochę. And a little bit more, it will be about 30 milliliters for each side. Jak się pan czuje? Wszystko ok? The patient feel no pain, only my passing under the skin. Okay. It's all. Teraz na wprost. Okay, now we are prepared for next stage. After several times we'll use endolifting. You should know that there is a monopolar RF, so the patient should have in her hand the connector. No, this is the head for patient hand, because the RF is monopolar from SmartCure. Okay, now I am prepared. My device is prepared too. As you previously had seen this that we've got continuous wave mode in 25 watts of radio frequency. Now I take the cannula. Okay. Now I'm going to the entrance point under the skin. Okay. Can you see it? I've got, of course, switch put on the floor. And I will start the procedure. Okay. Stand by. Okay, we are ready. Can you hear the specific sound? This is the emission of radio frequency. Maciek tutaj wziął, przyłączył kamerę teraz, wiesz? Okay. I can see that the small amount of fluid is going down from the hole. The fluid content from subcutaneous fat. Jak się pani czuje? Patient is painless. Spieprzenie po angielsku. Look, the superficial branches of facial nerve are here. I'm here with my cannula, so I avoid to going too high. We will check the temperature from thermometer. Okay, zobaczmy jaka jest temperatura. Let's check the temperature. 36 degrees. There is nothing. Takie dziwne uczucia. We are working, we will be working till the temperature will achieve about 41 Celsius degree. Let's check. Now it's 40 degrees. It is about 40 degrees of Celsius. Jak teraz pani się czuje? Jak będzie coś bolało, to proszę mi mówić. Let's check the temperature. It's about 32 Celsius degrees. It's a good result. So we will have this temperature, we will have this temperature for about 1 minute. And next, we can change the regime. Okay, let's check the temperature. It's about 32, 33. It will be enough. I will work for about 30 minutes and I will stop. I'm going to the neck. Okay, let's check the temperature. It's 43. It's good result. I will take away. Okay. Now I will go to the left side. Okay. Let's start. As you can see, I turn the switch foot on during when I go out. It's more safety, more safe for our patient, and I can control where am I. Jak się czuje? The patient feels good. When you are more skilled, you can use the energy, can give the energy going in and going out. Okay, let's check the temperature. The temperature is low. It's about 34. So I should work more. Of course, the time of procedure depends on temperature, which we achieve during the operation. Zmieszka się teraz. Nothing change. Nothing has changed now. I think with several minutes and the temperature increase. .5. Let's work. Okay. 39.40 Celsius degrees. It's significant better. Nie ma krwi. .41. This is a fatty content from the entrance point, from the hole. I try to not achieve this point, not to burn the skin. Let's check temperature. 42, 41, 42. It's okay. And now I will work about 1 minute. As you can see, this is the fanning technique, like during the volumetry with hyaluronic acid. This is the same technique. "42, it's good. It's enough for the results. Okay. Okay, it was the second area. We can see that the small amount of fluid going out from the hole. But I think that I will perform a small liposuction after. Now we are going to the medium region. As you can see, I didn't increase the power. I work with 25 watts in continuous wave mode. Now I will go to the submental region. Before you can pass and pave the road for cannula, and I will start the same power, 25. And now I will do the fanning technique to avoid to go deeper. Zaraz będziemy kończyć. Wypalamy ostatni tłuszcz. We burn all fat under the skin. The cannula is very elastic and allow me to work in this shape of the face. We are working on submental area. Let's check the temperature. 40. It's not enough. course, you can use the visual thermal camera, but when you are more skilled, it's not necessary. You can use only thermometer and assess the procedure with the thermometer. Okay. 42, 43 Celsius degree, it's good. And now I will work about 1 minute and I will change the side. Okay, let's move on to the right side. Niech pan tak sobie leży jak teraz. Now I will go here and start heating. You can see there is a little redness, little edema, but not huge. Zobacz, jakie jest stwierdzenie po angielsku. Yeah. During this procedure, you can see a strange sizzle, like burning eggs, like burning eggs. This is subcutaneous fat. This is a strange sound. That's normal. Okay. Let's check the temperature. 38. Jak się pani czuje? Now I will try to aspirate some fluid content from this region. Okay. I've got a 15 centimeters cannula with backlog syringe. It's good syringe for liposuction. Now I will go here from the preauricular area. I have to do a little bigger hole. A to była zawsze ta, którą robiliśmy. Okay. I try to take some subdermal content, subdermal fat. Jak się pani czuje? Boli? Patient is in good condition, feels nothing, no pain. And as you can see, I will take some subdermal content, fluid content to improve the healing process. Okay. It is 5 milliliters fluid mass. Now I will go to the submental region. Naprzeciwko, tak. A little more open the hole. Okay. Maybe a little more. Of course, there is not classic liposuction of the chin, but it improves the effects of endolifting. Okay. Now I've got about 10 milliliters fluid content. I go to the right side. This is a very good aspiration syringe. Backlog, I like it. $15 milliliters. Now I will go. Pani ma trochę tego tłuszczyku. A little bit more and I will finish, not to disturb too much submental area and subcutaneous tissue. Wszystko dobrze? Czy boli? Czy pani się tak nieprzyjemnie? Okay. And left side. This is the final point of our procedure. I will go to the jawline area and neck and take a little fatty fluid content from this region. The anesthesia is quite good, so patient feel nothing. Maybe sometimes when I go a little bit deeper, so as you can see, there is a edema. Patient is swollen, a little redness, and I've got almost 25 milliliters of fatty fluid content. So I think that I will finish at this time. Now we wear the elastic band. We will show you it, and we will arrange the next 3 sessions of combined radiofrequency and microneedling and non-ablative erbium glass laser for the all of the face. So this is all. That looks. Now, as you can see, the patient has worn elastic band to improve the region of the submental and neck region and jawline. And this elastic band will be during the next 38 hours. and after that, during the next all week, every night. And I will see the patient probably after 3 weeks, or if it would be any complication, I will seek care immediately. So it was all what I wanted to show you. I know that this procedure is quite new, and we should work more and more to assess the results and to look for our to take care of our patient, and I need more longer follow-up. But everything looks very interesting and very safe for the results. But of course, plastic surgery is the first place for that such patient. It is obviously, I know about it, but there is a lot of patients, as I said in my lecture, which don't want to have performed surgery. They prefer a little more invasive procedure, and this procedure, in my opinion, is non-invasive, is with small invasive and with a small adverse event after. When I look at the 60 patients which I did. Thank you for all. Bye bye, everyone.